Did we ever ask ourselves this question? That do we really understand medical terms or not? Because medical language is actually different. For example, you could say that lost blood causes the blood pressure to become low, but in medical terms, we usually say acute blood loss resulted in hypovolemic shock. So it is like low blood pressure, but we term it hypovolemic shock. Lost blood, we term it as acute blood loss. Another example could be, you could say in simple English, protein leaked into urine, so swelling happened to the patient. But in medical English, we say heavy proteinuria caused hypoalbuminemia, resulting in a generalized edema. So the generalized edema is the medical term which is used for swelling, and heavy proteinuria is the medical term when we say protein was leaked into urine. So we have differences, and medical wordings are different actually. Another good example is the kidneys did not get enough blood. This is what we say in normal simple English, but in medical English we say reduced renal perfusion led to acute kidney injury. So anything that actually happens, if there is no wordings that mention that it happened earlier, okay, we add the word acute to it. Did you notice? And then about the kidneys did not get blood line, we replace it with reduced renal perfusion. So getting blood, perfusion, alright? Kidney, we translate into renal. So we have to translate actually. With practice, this becomes much better, inshallah. The patient lost blood. This is the simple way we say. But in medical terms, we term it differently. The patient developed acute blood loss. Did you notice the word acute comes everywhere whenever it's not mentioned that it's chronic? So we just add the word acute to the things that happened recently. Okay, and also the patient developed. It's like they love to add a touch of thing like as if it's British. The patient developed acute blood loss. Anyway. And anything which is not enough or less, we use the term reduced a lot in medical systems. Like, for example, the organs did not get enough blood. We call it reduced tissue perfusion. Okay. And also, if someone says the kidneys stopped working well, we say medically reduced renal perfusion led to acute kidney injury. As you know, the acute word keeps on repeating everywhere. But did anyone say that the kidney had reduced perfusion, like less blood to it? No one said, but we just assume it or like add things like that. Reduced renal perfusion led to acute kidney injury, because this is which happens. I mean, it is the blood supply that actually reduces, which in turn causes kidney injury. So the final outcome is always actually the reduced or blocked blood supply. And another example is whenever we say something blocked something, we don't use the word blocked, we use obstruction. A stone is translated into calculus. A stone blocked the ureter. Medically we say a ureteric calculus caused urinary tract obstruction. Okay, in simple language we say urine collected above it. In medical terms we say the obstruction resulted in hydronephrosis. Okay, so urine collection, urine is a water, so urine collection we term it as hydronephrosis. Obstruction is the blockage. We never say that the kidney became damaged. We say that the prolonged obstruction impaired renal function. Impaired renal function. We point the damaged thing to function. Okay, renal function. Kidney damage, renal function has been impaired. Alright? For example, something has spread, like the infection has spread. We say medically the infection progressed to systemic involvement. Spread means systemic. Okay. Progressed to systemic involvement. And in another example, we might say, for example, the whole body reacted. But medically we can term it as or phrase it as the patient developed sepsis. Okay, that you want to say that is due to bacterial infection, but medically we say secondary to bacterial infection. So we can replace the word because with secondary. The patient developed sepsis secondary to bacterial infection. Okay, so whole body something happened, we term it as sepsis. Because becomes secondary. Alright? And as I said, they want to sound things like as if British, like the patient developed sepsis secondary to bacterial infection. The next example is the appendix became inflamed. But medically we say the patient developed. Again, the word developed. Do you see? They always remember that they want to sound British. And appendix became inflamed. Nothing was mentioned of chronicity. So we use or add the word acute to it. So the patient developed acute appendicitis. And another thing we could think about is the appendix burst. Medically you could say the appendix perforated. Okay, perforated. The appendix perforated. So the burst is actually translated into perforation. These are the words you will keep on finding, and they really help while presenting history and cases, of course. And also there is a new thing that I want to add, is that vomiting, okay, and diarrhea, these things are called GIT fluid loss, gastrointestinal fluid loss in medicine. Okay, so for example, if someone says the patient had vomiting and diarrhea, medically you will translate that as the patient experienced. Okay, experienced. The word experience, always remember this, experienced significant GIT, gastrointestinal fluid loss. Alright, and another could be the body became dry. So medically you say dehydrated. Okay, this is easy actually. And when we say the heart couldn't pump properly, remember the word pump. The heart pump properly means what? It pumps to actually to systemic circulation, right? To the entire body. So medically you say the patient developed. Again, the word developed. Remember British, yeah. Again, So the patient developed impaired function. Okay, as we don't call anything damaged, we replace that word with impaired function of left ventricular, left ventricle. Did you understand? Another famous example, which is like really easy: blood stayed inside the lungs. We call it pulmonary congestion. Okay, pulmonary congestion is blood inside the lungs. So anyone who says, okay, I'm feeling breathless, we call it dyspnea. Pulmonary congestion manifested as exertional dyspnea. Why? Like pulmonary congestion caused, okay, it resulted in. So in medical terms, we use manifested. Okay. So let's be quick for the other example. Simple English, the tumor spread. Medically, you will say the malignancy metastasized. Okay, the tumor spread. Medically, you say the malignancy metastasized. Simple English, nearby organs became involved. Medically, you say local invasion occurred. Simply, you say the patient lost weight. Medically, you say the patient developed cancer-associated cachexia. Okay, if we are assuming that it's cancer we're talking about. Otherwise, you wouldn't say cancer-associated cachexia, alright? Blood pressure became very low. I guess I said it earlier. The patient developed hypotension. Organs didn't get blood. Medically uses systemic hypoperfusion occurred. Systemic because we're talking about organs in general, all the organs. Okay. So medically uses systemic hypoperfusion. Okay, reduced perfusion, hypoperfusion, whenever it's about blood. Simply you say, simply, for example, if you say waste products increased, medically you would say reduced clearance, okay, resulted in something. If it's about kidney, kidney slowly became damaged. Medically you will say progressive, as it's progressive, right? Slowly became damaged means it is progressing, it is becoming worse or leading to something. So progressive nephron loss occurred, for example. Simply you would say kidney function fell. Medically you would say glomerular filtration rate gradually declined. In simple English, we say acid damaged the lining of the stomach. Medically we say gastric acid, alright? When we are talking about stomach, we say gastric acid. Gastric means stomach. So gastric acid caused mucosal injury. See how specific it gets. Mucosal, we use that term for linings. Another famous example is an ulcer formed. So we say, to be more specific, if it's in the stomach, we say peptic ulcer formation. Or the ulcer bled. Medically we say ulcer erosion caused upper GIT bleeding. Always remember, whenever it's about bleeding or loss of a fluid, it is better to actually mention the word gastrointestinal. This is a key. Whenever it's about fluid loss, like vomiting or diarrhea or blood, if it's part of GIT, it's so perfect to actually, or elegant to add the word gastrointestinal bleeding. Too much thyroid hormone formed. We won't use the word or the wordings too much. we use medically excess thyroid hormone production occurred. Okay, happened, occurred. Something is produced. Simply we say body metabolism became faster, but medically we say an increased metabolic rate developed. If you say that the patient has fast heartbeat because of thyrotoxicosis, how would you phrase it medically? You would say the patient developed tachycardia, okay, increased heartbeat, tachycardia, because you will use the word secondary instead of because. So tachycardia secondary to thyrotoxicosis. When we say brain cells died, this is actually not medically correct. In medical terms, we say cerebral. Okay, brain, we call it cerebral. Always remember, brain, we call it cerebral. Cerebral, okay, cerebral ischemia. Cells died, ischemia. It resulted in neuronal injury. What does our brain have? It has lots of nerves, so we make it more specific. Neuronal injury. If you want to say one side of the brain became weak, medically you would term it as the patient developed one side, right? So contralateral hemiparesis, weakness. Blood stopped reaching the brain. Cerebral perfusion was interrupted. Stopped, we call it interruption. Stopped, interruption. Okay. Block. So do you understand? Block will be replaced with obstruction, and stopped will be replaced with interruption. So these are the things, if you keep on practicing, you will improve, and then you will sound medically elegant and things will make much more sense, to be honest. Let's talk about lungs. A clot went to my lung. So a clot, replace it with the word medical thrombus. Okay, the thrombus embolized, okay, to pulmonary circulation. Lungs, pulmonary. When we talk about lungs, we talk about the circulation. This is what matters in the lungs, okay, the blood perfusion. So we say the thrombus embolized, like as if it blocked, okay, embolized to the pulmonary circulation. It's traveling, the thrombus, the clot is traveling, so it went to the lungs. Blood couldn't flow. Pulmonary arterial obstruction, okay, like block, right? Obstruction occurred, happened, occurred. The patient became breathless. So the patient developed sudden dyspnea. Iron became low. Medically, we say iron stores became depleted. This is so interesting. Iron low, we don't say that. We say iron stores, okay. Whenever we talk about iron or ferritin, we call them stores. So iron stores became depleted. Hemoglobin decreased. Iron deficiency resulted in microcytic hypochromic anemia, which is the most common actually. The patient came tired. So the patient presented fatigue. Like tired will be translated as fatigue, okay, or reduced exercise tolerance. Mostly it happens as a result of anemia. Sugar stayed high. We don't say diabetes, we say hyperglycemia developed. The kidneys leaked sugar. We say medically hyperglycemia resulted in glycosuria. Okay, leaked sugar in the urine, right? So this is glucose, so glycosuria. Hyperglycemia resulted, high blood sugar resulted in sugar in urine. So hyperglycemia resulted in glycosuria. The patient urinated a lot. This medically, what do you think? Polyuria? Yes. Let's be quick. The liver became scarred. Okay. So anything, any scar in liver, we call it cirrhosis. Okay, became scarred, progressive, slowly became scarred, progressive, hepatic, liver, hepatic. Okay, liver will be translated into hepatic fibrosis, resulted in cirrhosis. Yeah, so scar is fibrosis in medicine. So fibrosis results in cirrhosis in the liver. So the blood couldn't pass through, which means portal hypertension. Blood could not pass because there is high blood pressure. Portal hypertension developed. This is important. Blood couldn't pass, portal hypertension. Simply we say fluid collected in the abdomen. Medically we say portal hypertension led to ascites. The patient says my airway became tight. We call it bronchoconstriction. This is easy actually. Became, whenever the patient says became, okay, as if it happened. So you say bronchoconstriction occurred. The airway swelled. Airway inflammation caused mucosal edema. Edema is the word used for swelling. Simply we say more mucus formed. In medicine, we do not say more or too much. We use excess. Excess mucus secretion. Narrowed the airways. Easy. The airways became narrow. Chronic airflow limitation developed. Became narrow. This could be actually said in a more simpler way. Airflow is limited. So air became trapped inside the lungs and the lungs became bigger or hyper expanded. So medically you say air trapping resulted in, okay, it resulted in, it made this happen, okay, so resulted in lung hyperinflation, expansion. Well, I hope it helped, and if it didn't, then repeat the video, watch it 1 or 2 times more. This is gonna help, inshallah.